Hello, everybody. This is another episode of the Mind Body Marathon podcast. And on today's show, on my left, we have Dr. Matt Pisanelli, kind of frequent guest here, member of the clinic. And on my right is Jared Bugaj. Is that how you say your last name?
Bugaj.
Bugaj. Yeah, I always been getting that wrong. And Jared is about 6 months out from graduating chiropractic school?
Yeah.
Yeah.
And try 9.
Yeah, so that's exciting. And so today we're going to kind of talk about like different treatments and different modalities and stuff that people can do on their own, and kind of how people should phrase their overall treatment of their bodies with injuries and performance enhancement. Um, this topic is really important, I think, nowadays because the field of like you know, foam rolling, scraping, therapeutic guns, percussion guns, like all of this stuff really didn't exist like 20 years ago. And now it's like pretty much everywhere.
Yeah,
You have
just hit-
Normatec boots everywhere, you have scrapers everywhere, you have cups, all this stuff. And so I think it's important for people to understand some of the basic tenets to how to utilize these services and how to best utilize them on yourself to get the best results. So
Yeah. Beforehand, we just had static stretching and rest and ice. And
yeah, I mean,
it's
like if you think
changed
about like
drastically.
what guys did in the 70s, guys and gals when they were runners in 70s and 80s and stuff, and like they basically, I remember I heard this crazy interview with Emil Zatopek, and he talked about how they used to use wine bottles to like roll out their muscles.
Mm-hmm.
I'm like, that is
Oh my
awesome.
gosh.
In the 1950s, that's where they were at, is wine bottles.
Yeah, but that was even still ahead of its time.
I know, it's
thinking
pretty
about that.
incredible. They realized like they literally thought of like rolling pins, like you just use a wine
Mhm.
bottle and like a rolling pin to like roll out your muscles, which was pretty cool because that was the
Yeah.
precursor to the stick,
Yeah.
which I think was just coming in our era of
In
running
the late 90s.
in
Yeah.
the late 90s. But yeah, we've definitely come a long way. So I think it's important for people to sort of understand all these components because we are in favor of them. We do them. You name the soft tissue technique, we do it. And I think that we'll kind of put a framework to all of it. So kind of to start out, Matt, so what's some of the baseline framework for your overall soft tissue treatments?
Yeah. So, I mean, here at the office, we emphasize a lot on active release technique. That's what, we started. That's what got me into chiropractic practice.
What does that even mean?
So active release is essentially a soft tissue treatment where we use our manual hands to pin down a muscle and then move a body part adjacent to it to slide a secondary muscle. So if you have a muscle here and another muscle, we pin this one down so it doesn't move, and then the one next to it slides past it. And it just basically unvelcros the two tissues from each other to make them, looser, more, functional in that aspect.
Yeah. I would consider that sort of a foundation of my treatment as well.
Mhm.
I think, do you know much of ART? Have you-
Yeah. I've taken upper
Oh, you've done upper?
one. Yeah.
Yeah, that's fun.
Mm-hmm.
I like it because it sort of gives you like a surgeon's level of anatomy.
Yeah.
It just spices that up and really is pretty pronounced with that. And I think it's a good framework because what Dr. Matt's alluding to is that if you went from the skin down to the bone, there's thousands of layers of tissue. Now there are in this tissue, if we just kind of take, our bicep from the skin down to the bone, there's all these layers of tissue. And the bicep sits on top of the brachialis. And so in this area, these two muscles can literally stick together. And a lot of times that can create some restrictions. Like I know this is big with like shin splints is a great example. Your soleus will stick to your gastroc and the calf, which are two key calf muscles. And ART just teaches you how to loosen those two structures up relative to each other. But what's interesting in addition to that is when you start to get into other techniques like scraping and cupping, they kind of work along some different fronts where they sort of work to shear the muscle a little bit different or shear the fascia relative to the muscle, which is kind of the casing of the muscle.
Yeah. I also think it just helps improve your technique overall with feeling the tissue. Before, most people when they get soft
Oh
tissue
yeah,
technique,
if you're doing ART,
they just mash
Yeah.
a muscle down. And ART is very specific on making sure that you get to the very specific depth.
yeah,
So like again, you'll have think of like a hamburger where you have the patty, then the the lettuce, the onion, the tomato, then the burger, and you have to push down to get to a specific level.
yeah,
So now instead of just mashing on a muscle trying to create it to get it softer, you're specifically getting to the tissue that's actually like injured.
Yeah.
And it's softer for the patient. It's easier to handle. It's more effective because now you're only treating the thing that's actually damaged and not necessarily like all the
Yeah.
structures.
Yeah, I think if somebody's learning, if somebody is wanting to try to understand how to utilize this in their own way at home, kind of the way to think of this is like, say you were like foam rolling your calf. Um, if you kind of just apply a little bit of pressure to a certain part of the calf, you might be on a more superficial muscle.
Hmm.
But then if you kind of lean in at a little different angle, you'll find all sorts of new trigger points, and that might be a deeper muscle. And it's important to understand that you're kind of working through one muscle to get to another one. For instance, if my calf is if my foot is totally relaxed while I'm foam rolling my calf, I can get to a deeper soleus. But if I contract my foot up, the gastroc will draw tight, and then that'll kick me off the soleus, and then now I'm working a different muscle. So that you'll find that a lot of times if you're foam rolling, if you contract a joint in one direction, you'll get a different release versus another.
Hmm. Yeah, and I think both myself and Dr. Leo, and we emphasize on that because it also gives us a hands-on approach of just touching the tissue and feeling what needs to happen. So we might be working on one muscle, and these fingers that aren't touching the muscle that's being affected are assessing the movement of everything
Yeah.
else. So now if I'm working in, his shoulder and I'm working on the front, where I'm feeling tightness, but then I'm assessing back in the back of the shoulder where my fingers are, I might notice that this isn't moving at all. And even though he has pain here, I'm now assessing the backside. So it gives us a better understanding of the whole entire joint complex,
Yeah.
throughout the treatment process.
So one of the things I wanted to we'll kind of get back to like some of the cupping and scraping and kind of how to organize that for your home technique. But one of the things I wanted to touch on pretty quick is um some of the TikToky kind of trendy chiropractic stuff. Um and so Jared, since you're going through school and you're kind of, obviously you're learning chiropractic techniques, do they teach you some of these crazy techniques in
Um,
school?
I think some of them that you see on, the social medias, like those big ballistic movements, those aren't taught in school. Those are
Yeah.
just things that pretty much a bunch of guys getting together on a Friday night at a dorm or at a house, and over a couple drinks, they just, all right, well, let's try this thing out.
Yeah.
We've seen it once, and
So it's
so
not a formal technique per se.
no,
Yeah.
no, it's not.
And neither was it when we were in school, and I think, it's clickbait,
Yeah,
right? And so these chiropractors sort of know that, and they're obviously marketing, and they're sort of like, people are just obviously, like, sort of addicted to the crack and the sound of it,
Mhm.
and it's such a different thing, like the chisel and hammer moves, and then the big whopping cracks and things like that, like, we are all chiropractors, and we do a lot of those, like, adjustments that will create sound, but they're very specific in terms of getting a joint to move, and not all chiros specifically do that. Like, definitely the vast majority are not even trying to do some of those big broad motions. I like the word ballistic because that's
yeah.
pretty much what it is.
Yeah, it's a a like cervical distraction, like the distraction tables, and it's basically just yanking on someone's occiput, their head,
Yeah.
and what we're taught in school is, there's a reason for an adjustment. Why would you do an adjustment on just a body region for no reason? There's no diagnostic with it, and so that's where motion palpation is key from my upbringing. Is finding a joint that's restricted, and a complex of joints that are restricted, and there you can then extrapolate that out into an adjustment that will restore motion
Yeah.
into that complex. The transitional segments, the base of the neck, and kind of like the where the ribs end and the low back begins. Those are some of the most restricted
Yeah.
regions on patients. And
Pretty much where everybody feels tension.
yeah,
Mm.
And I love that there's people debunking it online, and there's like orthopedic surgeons and stuff like that breaking down the anatomy. I think it's great, and I think it's really good that they put the information out there and let people know that Because I've had patients request some of those techniques.
Oh yeah. I'd probably say once a month somebody's like, "Oh, can you do like a ring dinger or something like that?"
The Y strap,
Yeah.
Mm-hmm.
and which is basically where you kind of hook a strap to the head and just yank on it.
Yeah. And I'm sure, I mean, it does probably relieve some people's pains, but it's not constituted all the time,
Yeah.
if very rarely. And there's better ways of doing it that are less aggressive. And I went to New York Chiropractic College. We were taught one day of axial distraction type of maneuvers, just because it could have been tested on the board exam. And so we had to kind of go over it. And we, practiced it one attempt, and that was it. Because I mean, again, it can be really good for, if some fascia is, basically tethered to the cord, and you can really get that. But it's probably the most aggressive move that
Yeah.
is out there. And
It's so rare the cases that would actually need that.
yeah, that I don't personally practice it myself. So
And what's interesting with the TikTok trend of like the chiropractors putting the mics by the cracks and stuff, that is kind of taken off a bit. And in my mind, that's kind of that sort of asthma world. Does anybody know what that means? That I'm talking about? What is the autonomic? It's like autonomic sensory. Yeah. So basically, that's like here, I'll look it up. But if you're yeah, asthma meaning. So ASMR, autonomous sensory meridian response. It's a tingling sensation that usually begins in the scalp and moves down the back of the neck, upper spine, and it's sort of a paresthesia. It's an auditory tactile synesthesia. So if you go to YouTube and type in ASMR, you'll see all sorts of crazy videos about this where it's just sounds that are stimulating, um, that put people into sort of like a little bit of a trance. And a cracking sound, a popping sound of an adjustment is an asthma. And another great example of an asthma is like the scraping of a pencil on a piece of paper, like so if you watch some of these videos, it'll literally just be a video of people writing, and people listen to this to like calm their brains for relaxation. There's something therapeutic about it, and it's a literal uh, mechanism in the brain that's just is very calming for the autonomic nervous system. And I kind of feel like that's where those
Yeah.
TikToky things come. I think people are sensing that, and it's almost along the same fetish line as like the Dr. Pimple Popper stuff, where the
yeah,
motions are so odd and ballistic and weird that you're getting the auditory sound, but also the visualization is so unique that it's enticing.
Yeah.
well, I think in general too, like if you think about like a chiropractic adjustment, I would say a majority of people, at least those that may have not had a bad experience with chiropractic, like they visually like associate that, and like the sound of popping will bring relief. Like how many people just like, lean back in a chair and their back cracks and they're like, oh, that felt good. Like,
Yeah.
so when they hear it, it's like Pavlov's dog. Like
Yeah.
they just almost start to salivate, thinking about that. And so the bigger, the louder the crack, the more that they think that they're like, oh, that would be amazing. And so now when you put a microphone, in it, bones were designed, well, not designed, bones throughout history have always like helped with sound radiation. That's why the first instruments were made of bone.
Yeah.
They amplify the sound of of
Well,
sound
that's how
waves.
your skull is designed.
Yeah, and so because of that, like that's why you might be like, oh, my shoulder keeps cracking, and then you palpate here at the clavicle, and that's where the sound is, and then it's because it travels faster through bone here than gets to your ear,
Yeah.
than traveling upward, and so now you take that same sound and now you amplify it with technology, and people are just going to associate like the amount of pleasure that somebody would get from that type of an adjustment.
Yeah. Um, do they teach you in school what makes the popping sound?
Yeah. I mean, what we were taught is that the negative pressure that's produced by gapping
Like a
those
vacuum.
facet joints. Yep. The vacuum uh, it produces the gases that are within the synovium, the joint fluids, falls out of solution, creates an air bubble, and that crack is the sound of that air bubble being formed actually.
So there's nitrous oxide in the synovium. And so like it's like if you have a can of pop and you snap it and go you get a quick release of pressure. So the carbon dioxide of the bubblies in the pop will pop out, and that's what creates the sound. And in the joint, when you quickly create a separation of the joint, then what happens is nitrous oxide and other gases will pop out of solution, and then that creates the sound. But nitrous oxide is laughing gas. So it actually like is therapeutic for the nerves around it. So that's why it actually feels good. It's literally laughing gas.
Yeah.
And so that's
Wow.
it's very stimulating for the nerves. And it also is a blood vessel dilator. So it helps to immediately open up the vessels in the area to bring blood flow to that region that you just released.
Yeah, absolutely. And
So
it does depressurize the joint just
yeah, and it
slightly.
depressurizes
Like
it.
if you take a glass of Coke or Sprite or whatever, the inside of that glass is going to be, lined with tiny little bubbles. So imagine you taking a vacuum and you suck out all those bubbles into one giant thing at the top. So the water level will actually dip down just a little bit. So you give that joint just microscopically a little bit
Yeah.
more freedom to kind of move about.
And even, if a chiropractor does an adjustment and there's no sound produced, that doesn't mean that there wasn't a therapeutic effect.
Yeah.
And that's something that, it at Logan, they hammered home to us is that, maybe your technique wasn't as proficient. Maybe you're not at the end range of motion and to lockout, but the to have a therapeutic event benefit to a patient, it doesn't need to produce
Yeah.
that pop sound.
Yeah.
And
Well, I mean, anybody that's been treated by me, like a lot of times I'll use a percussive gun.
Mhm.
I'll use a drop table. Other different techniques that we can move a bone in space, but not necessarily create an audible, like a pop. Yeah. So, and I think that, so kind of let's move into the little bit of a realm of like, if we look at the way the body is organized, part of the reason why I went into chiropractic is, um, if our nervous system is organized so that we pay attention to our skeletal structure, our joints, our bones. And then if those are fine, then we'll recruit muscles accordingly beyond that to create a normal motion. So for me to pick up this glass here or this can here, my brain is assessing the quality of all the joints. And if it likes it, it'll load that limb accordingly. Um, if we're treating people, it makes sense to go to the very heart of the way our nervous system is organized, which is the joint, and then we can work our way out from there. Now, a lot of times, other professions like physical therapy or massage, they don't look at it that way, which in a way isn't necessarily bad, but it's not as comprehensive. And so that's often why if you can master joint mechanics, it's much easier to master soft tissue on the back end. But the reason why we go through so much school, like 4 years of school in addition to an undergrad, so 8 years total of school, um, is we have to master joint mechanics. And that's kind of what Jared was talking about earlier.
yeah. Um, and where dysfunction originates from is a big question that we ask ourselves. Like, and as a student, it's always trying to find, where to target an intervention based on a patient's presentation. And like respiratory mechanics, if the body is not able to create adequate pressure in the from the diaphragm to the pelvic floor, then you're already setting yourself up for instability and dysfunction
Yeah.
because that intra-abdominal pressure isn't being formed, and you can't move around an unstable base.
Yeah. Yeah. So in other words, like if you're going through like physical therapy and you're doing a bunch of clamshells to get rid of your knee pain, it's fine. That's okay. Um, that's a very like, vanilla approach, but it would be better to make sure that you're comprehensively moving adequately in your core and stabilizing. And then the sequence of musculature from that point out will be much more activated. So if we are stable through our center of mass, then we're going to be more stable on our hips and knees and feet and etc. And so to make all those motions that much more effective.
Yeah.
Yeah. That's a really good point there. So, but I think so that's why we kind of focus on joint mechanics, in our practice. And then obviously we do a lot of the soft tissue and stuff. So I think it's but when people are kind of at home treating themselves or kind of trying to tinker with some different exercises, obviously people aren't going to be able to do that. And so when they're out of the office, what are some of the techniques you like to tell people to kind of practice on their own to release things?
Yeah, I mean, I think starting out looking at what most people have available to them, I would say by now, if you're, most bit of an athlete, you probably have a foam roller at home, um, some type of lotion. So a lot of the times I teach patients how to just do some soft tissue stuff, cross friction. So basically, if a muscle is going up and down, you rub against it. The opposite, parallel, portion with some, hand lotion even doesn't even matter. A lot of the times I've told patients just to take the back of a spoon or a fork
Hmm.
where it's like a little bit less of a sharper edge. And they, again, just taking hand lotion can scrape, if somebody
Yeah.
has what's called de Quervain syndrome, where the tendons in through here get caught in a sheath, to work that. And you just, tell them, exactly, where to put the application of treatment.
Yeah.
And then you kind of show them the depth that they should go to. I usually will, push lightly on their hand and be like, that's all the pressure that you need.
Yeah.
Because most people, unfortunately, we live in America and they think, more is better.
Yep.
And so
Yep.
they are like, oh, well, if this amount of pressure, made me feel better, if I really dig deep into it, it's going to
Yeah.
be that much better. And no, that's usually not the case. So I'll usually, go through.
Yeah. And people can go to just their Amazon account and buy a $5 gua sha tool.
Yeah.
So GUASHA gua sha. And those are super cheap and just basically like little contoured tools that kind of come from the Japanese technique of scraping. They used to use chess pieces back in the day.
Yeah.
They kind
Oh
of
my
like
gosh.
releases. And so yeah, so basically what Matt's talking about is you kind of just get in there and just scrape the tissue. And a lot of us know what area feels restricted,
Mhm.
when we're moving, when we're working, when we're running and being active. And so you kind of just want to just get those areas to be not so sticky.
Yeah. I think more so than telling a patient how to treat themselves, I tell them how not to treat themselves.
Yeah.
I show them the structures that they can damage. So blood vessels, nerves are the biggest thing. So a lot of people want to, just take a lacrosse ball and dig into their glute muscle because it's painful. And I'm like, wow, there's a really big nerve that's going to feel like a trigger point.
Yeah.
So, I tell them about like what it should feel like. And then, if you're on the nerve, what that's going to feel like. Cause it's
Yeah.
initially going to feel good because you're choking out the nerve and it's going to basically dull it. And then all of a sudden, about 20, 30 minutes later, you're going to be like, wow, this pain's back. And
Yeah.
it's a little bit worse.
So like one time, so like basically it's hard for us to, even as physicians, tell the difference, like if we're foam rolling to feel the difference between a nerve and a muscle. Like they feel very similar when you apply pressure to them.
Mhm.
A common area for this is the upper back, kind of between the shoulder blade and the spine. Like people just like kind of leaning against walls and like digging in there, and they can just be like literally just rolling over two key nerves and then just flaring those guys up. But I have a funny story about that. So one time I was racing in Virginia Beach and we were in the elite athlete area. And then this one girl knew I was a doctor. So she was like, oh my God, my like hip is killing me. And, like, is there anything I could do before the race? And I was like doing my own warm up and it was like literally like a half hour before the race. So I'm like, yeah, no, just grab that foam roller and just kind of roll the hip out. And I just said it just like that. So then she grabs the foam roller and she's rolling on her glute and, she doesn't have a lot of mass back there. So she was probably just rolling right over the sciatic nerve. And then she comes up to me like 5 minutes before the race and she's like, I don't think I can even race because my whole leg is numb right now. And I was like, oh my God, I'm so
Ooh.
sorry. I didn't really want you to roll on that part of your glute. And I should have like paid attention. But she just like started rolling in her glute. And I just was thinking more of the side of the hip. And she didn't take it that way. And so I felt really bad. So she couldn't really race.
That's something like
But that's the risk of rolling just on sore areas. You have to kind of sort of know the anatomy. What were you gonna say?
yeah. in college, I saw a bunch of my teammates like rolling directly over the IT band and just up and back on the IT band. And it's like I knew a little bit about anatomy and the gluteal structures that attached to that band of fascia. And it's like what are you doing? Like you're you're rolling over a band of just dense connective tissue. And
Yeah.
it's like
Yeah.
you might be desensitizing it, but that just looks painful, man. Like, wow.
Yeah.
But that's America. More
Yeah.
pain, the more pain, the better.
Yeah.
I'm getting deeper into it. So
Well, okay, so then that's the thing. So let's get back to foam rolling. So with that being said, um, if you are so a lot of people use the rolling as a verb, right? So when you're foam rolling, you have a foam roller, just like a round structure, and you're rolling back and forth. But really, what should happen is you should, when you find a sore spot, you should really just kind of hunker down on that sore spot and apply dead pressure on it until that sore spot starts to dissipate. And generally speaking, you're going to do this in sort of your larger muscles like your calf and your hamstring, your quad. And when you start to load in that way and you kind of roll to find the sore spot and then stop and then hunker down and hold the pressure on the sore spot, over time, what will happen is that knot will dissipate. And it's a gel to sole phenomena where you're basically getting a fluid transfer. Your body's sort of forcing more, not necessarily blood flow, but kind of warming up the acids around the fascia and loosening up those tight structures. But you have to hold dead pressure to it. And if you don't, and you're kind of just aimlessly rolling back and forth, you might get an increase in blood flow and, as Jared said, desensitization, but you're not actually functionally treating the tissue. You actually have to stop and apply dead pressure to it until it releases. So, any other suggestions with regards to that?
Yeah, well, after you release the tissue and it's in a long in elongated state, to follow it up with some kind of a loading strategy, because the tension and trigger points are there in my view to protect a joint and joint complex.
Hmm.
And the trigger point, the band of tight tissue is actually something that's generated by the central nervous system. And
The brain.
the brain. And um, you know, for that to keep reoccurring, how do we make a change that so that trigger point isn't there
Yeah.
even? And it's like if it's the hamstrings, how do you load the hamstrings to um, reintegrate that now elongated tissue back into the motor system and
Yeah.
into the brain. So following it up with some kind of an exercise, that's kind of what we
Yeah. No, I think that's a great idea.
and I think before that, like just facilitating more with the foam roller, you foam roll, you roll up and down to find where that trigger point is. Then, as Dr. Leo said, you sit on that structure until it almost kind of starts to go limp because it will literally relax. There's times where we're loading a tissue with our hand, and then all of a sudden, like the tissue will give out. I've like almost fallen on top of
Yeah.
patients
Because it just
because
lets
it just
go.
lets go. But then after that, I would almost say to tell patients to then start to flex the adjacent joints above or below that structure. So if you're working in the hamstring, you're usually already straight legged, unless you're foam rolling on a chair. So you're already going to be straight legged. So then start to flex the foot, which will tension the whole posterior chain below,
Yeah.
below that hamstring. And then you might actually recreate some more tension that you might find. But it gets the whole posterior chain
Yeah.
to now start
Right.
to tension through that.
So I would say it's important, since we're on the topic of self mobilization, myofascial release with a foam roller, um, that it's a great tool to use before you run or before you work out. Um, it helps loosen tissue up. And then, so say, you know, you would foam roll, and then afterwards, like Jared was saying, you would do some dynamic drills to sort of reintegrate that muscle into a better system or changed system because you increased it. So you do want to kind of foam roll before, but I also think it's smart to, like, if you're just kind of watching a movie and you're just sitting around, to also just pop out the foam roller and just massage your legs or back then. I think that's also good as well. So it's not terrible to do after you work out, but it's especially beneficial to do prior to workout. Now, kind of shifting topics, like if we head towards scraping and cupping, now those are techniques that you kind of want to do more after you work out, unless you have like a really irritated like tendon, like an Achilles tendon or a plantar fascia or tendons around the knee, like an IT band or something like that. Doing some light emphasis on the word light scraping around that area to generate blood flow and also desensitizing the tissue so you can get through the run or get through the workout. That's a total game changer, I think, for a lot of people. So for me, with my Achilles, because they're rotted out, um, if I just do some light scraping on the Achilles, even for just like 2, 3 minutes to just sort of desensitize it, loosen it up, bring some blood flow, it's a total game changer. Then I do the run. Then when I come back from the run, I'll spend a little bit more time cupping and scraping a little bit deeper on the area. And then that way we can not injure the tissue while we're running. We just sort of waking it up, but then we can get a little bit more aggressive after.
Mhm.
So any tidbits on that?
I think you touched on it. That was, that's what we're taught in school, is that the little cells that act as like the construction workers of the body, they lay down scar tissue when a tissue is damaged, and it's very haphazard. And then, by re-stimulating those cells, then you get a reorganization of those connective tissue fibers, collagen fibers, and for a structure to hold force, parallel fiber arrangements are always
Yeah.
better than like a matted, like a straw, haphazard, you know.
Yeah. If you sort of think of like hair, like if you had long hair, if you have knots in the hair, it's just very stuck and you can't really comb through it. But, if you had healthy hair where there was no knots, then you can get some good motion, some sliding, then it's not so matted down. The fascia will literally act like that. It will literally knot up and create scars and just kind of be pinned together. And then that creates very poor fluid transfer in and out of the body, in and out of that area for the injury. And then it also just doesn't move very well. It's also the reason why, like, as you get older, when you wake up in the morning, you're super stiff and tight. And then it just takes like an hour or two to just loosen up and get moving. That's this matted down tissue. So those areas that are tight or sore when you wake up in the morning, take a mental note of that. These would be the areas you want to scrape. These would be the areas you want to reorient the fibers, you want to stimulate the healing, you want to get the construction workers of the cells in that area, so and so forth activated.
Yeah.
Absolutely.
Now, cupping is basically just a little bit different technique there, where with the scraping, you're shearing tissue, you're increasing the friction across itself. So if we had two sheets of paper and they were stuck together, you're basically increasing the friction of that. Now, cupping allows for the decompression of it. So it allows you to unvelcro or unstick on a different axis of movement that tissue together. So there are two different techniques. They can be utilized together. One is not better than the other. They're literally just moving along two different lines of motion.
Mhm.
So I think it's important to kind of have also a simple cupping set. In our show notes, we'll kind of like attach a link to that, and then also some of the gua sha tools we talked about. But I think it's important, for $20, somebody can easily get a nice set of cupping sets, a nice set of tools, and then literally just do this, multiple times a week, if not every day, lightly on certain areas, and they'll get massive gains.
Yeah.
Yeah.
So,
Same thing with cupping. Less is more.
yes.
Typically, most of them have a handle that you squeeze and it creates a negative vacuum into the cup. And then it's got a pressure valve that will, when you take the tool off, it will keep the vacuum inside of the cup. So the skin pulls up into the cup. I would say generally most of the time, like when I'm treating somebody in the office, it's usually like 2 to 3 squeezes. If it's in a weird body part, I might get into a fourth one. And I say that just because the more squeezes that you create, the more vacuum it's going to pull. And the people who used to stick the cups when you're a kid, like on your chin, it'll cause bruising. And so there is a point where you can just create tissue damage, capillary destruction, in that adjacent tissue if you
Mhm.
leave the cup on for too long or you pull too tightly,
Yeah.
onto it. So typically, I would say try first starting with just two, two squeezes and leave it on. It's awesome
Yeah,
to
and
do.
not on for a long time,
Yeah,
like 10, 15 seconds, and, you just kinda wanna get in, get out like a sniper. You don't wanna be 5 minutes on one spot. You just
mhm,
apply a little bit of pressure, get some motion in there, take it right back off, move it to a different area.
yeah, and we take it to the next level. We create movement with that, so we'll cup a joint in the shoulder, and we'll move it through different ranges of motion.
Mhm.
You can recreate that at home. That's really safe to do, and I think is
Yeah, the other thing to kinda think about is, like, we're sort of shielded, our sensitive tissue is sort of shielded outside of the glute. Meaning, like, if we look at the neck and we look at the arm, like, the nerves are sorta hidden. So if you're treating the shoulder, you can kind of really hammer through the shoulder because, the shoulder is always in contact with the world, right? It's always, like, bumping up against things. So we've been creatively designed so that our sensitive structures are sort of tucked away and hidden. Now, so if your outside structures, like your outside of your hips, your quads, your calves, shoulders, like you can pretty much hammer these areas because they're already in contact with the world constantly, and there's really no like exposed nerves. So you just kind of want to just be smart and logical about it. Like you wouldn't want to like cup a groin or under your armpit. These are just not areas that feels good. But it's okay on the outside of the shoulder because there's really no exposed tissue other than muscle.
mhm,
So just kind of be like logical on that. If it doesn't feel right, then just move off to a different area.
yeah.
Yeah.
Now, I kind of want to address dry needling. So this is an interesting topic for us. So uh, we're in the state of Ohio, and so we can do dry needling. We can do all sorts of different cupping techniques, scraping adjustments, obviously all that different stuff. And it's interesting to us because there's actually a lot of therapists out there that only dry needle, and we find that to be a very weird experience.
Yeah.
Um, what's your take on that, Jared?
That's so, dry needling, you can get a therapeutic intervention as specific to the tissue depth and, what location you want to put it. And that's all awesome. But, if that's the only intervention you're doing to affect a change in someone's movement system, I think you're kind of being narrow sighted.
Yeah,
Hmm.
yeah, that's
Yeah.
definitely the case. And um, I often joke with patients when they see other providers that would just do needling. I'm like, could you ever imagine going to a mechanic and being like, oh, this one mechanic, all he uses is wrenches. He doesn't ever use a screwdriver. He doesn't use any other tools. He's just a wrench guy. And like that would just be so weird because a tool is only there based on what the needs are. So like a wrench is a really good thing to use for certain things, but it's also a very terrible things to use for other situations. So the same thing with like needling and cupping and scraping is like there's a time and a place for a lot of this stuff. And like with needling, it's so harsh and specific that in a lot of cases it's actually not a great thing to use. Um, so you just basically want to see people that are a little bit more dynamic and have like a little bit more tools in their toolbox and not just so restricted to a wrench. That seems kind of an odd technique to me, but for some reason it seems to be very popular. I also kind of find that needling is sort of lazy um, because you're not really understanding fluid dynamics. You're not really understanding the dynamics of motion. You're basically just kind of putting a needle into a sore area, and just kind of a. It's like throwing a grenade at something. It's like, yeah, you're gonna get a big blow up and release, but is it specific like a sniper? Like it's kind of like, did you really need to throw a grenade over there?
Yeah.
Like,
And does that make a lasting change?
correct.
After you release the tissue, we get sometimes what we call a twitch response where the muscle gets stimulated, a certain cell gets stimulated and it lengthens the tissue. And after the muscle has been desensitized, then what do you do after that? And
Yeah,
that's you keep coming back week after week with the same honking trigger point that it's been there for forever and always will be until
yeah,
you address some of the other
Well, I
things.
also think it's like dependent on why you're using
mm,
the dry needle. Like sometimes I'll needle the glute because somebody has a large glute area, and I just can't literally physically get my
yeah,
thumb deep enough onto their piriformis. whether it be adipose tissue, or I have a pro NFL football player who literally has a glute max that's like this thick.
You could like use 4-inch needles on them.
And my thumb is only half that distance. And so like, I just don't have the physical strength to get
Yeah.
that deep. Whereas like, if you're only going for trigger point, therapy, you're just, like Jared said, like, you're just literally going to come back. And the downside is, as a patient, you can't needle yourself. Like,
Yeah.
you cannot physically actually purchase the needles on your own. You have to have a
Right.
license. And so you're now 100% like a drug dealer. Like, you're dependent on that chiropractic,
Yeah.
to provide that. So
Yeah, that
I think
chiro
it's
or PT.
necessary. And I think some people respond really well to it, but it is probably the second most aggressive thing that we can do as a chiropractor. That besides doing an actual injection at that point. So it shouldn't be used just as
As a
like
standalone.
as a standalone thing.
Yeah, I definitely wanted to like make sure that's out there because I feel like people. The other thing too is that like Matt said, it's very aggressive, and you want to make sure you just kind of get in, release the tissue, and get out with as little stimulus as possible, because in the end, treatment is very demanding on the body, and if you have an athlete and you're throwing all this heavy stimulus at them, they might not be able to fully adapt to that, and you want to get the most bang for your buck, and so you want to go in, get a nice release of the tissue, get the benefits that you want in there, and then just pull out. And it's not a matter of it's just kind of being like throwing grenades at everything because the nervous system will get overwhelmed and that will actually detract from training. And I don't really think people understand that.
Well,
And that it's a stimulus, like it's like literally like doing a workout.
at the end of the day, like, what are we being utilized for? We're here to help with tissue injury. And so if it injured, or if a tissue is injured, it has to have time to repair. Like,
Mhm.
you can't just expect to get a treatment and then just immediately go out and perform. I mean, you will get a performance increase, but it has to actually repair. Immune cells have to go in. They actually have to rebuild the tissue.
Yeah.
And so with dry needling, it being so aggressive, you're literally taking a needle, which is like essentially a fine point, scalpel. You're damaging the surrounding tissue to create an immune response to basically get more white blood cells in to
Yeah.
repair. And so now you're taking an injury and you're actually slightly injuring it a little bit more, but in order to then get a better
To
response,
stimulate the
so
healing.
it heals faster. And so now, like, there's reasons why USA Track and Field, they have guidelines on like how far out that you're allowed to needle.
Yeah.
Like, it's one of the only techniques where they specifically tell you that you cannot needle within a certain
Yeah.
range of time.
Yeah. I don't
And
think
so
people understand that.
if you're only doing one technique, I practice McKenzie. McKenzie is a great, exercise based type of treatment. But when you go to a seminar, if you've ever had the pleasure of doing that, like, they are so about only doing McKenzie.
Yep.
And there's nothing else. It's just the same as active release. If you go to these seminars, one, you're paying to go to that seminar, so they're
Yeah.
not going to publicize other techniques. But those practitioners that are giving the thing, they only practice that technique. And so if you only have one technique, then you're refrained from, okay, if I'm going to needle somebody, well, what happens when they have to run later today?
Yeah.
Like,
Or what happens if you're trackside?
Yeah,
You're literally, you know, 2 hours away from a championship race. Like, what do you do then?
yeah,
Like, you have no way of releasing that tissue. It's
Mhm.
crazy that you would just be so locked into that one narrow frame of reference.
Or what happens if you've had a patient who you needled and they're like, I didn't like that. That didn't feel good. And then now you're like, well, I'm going to do it again.
I'm just going to keep using the wrench when
Yeah.
I need a screwdriver.
Yeah. So,
All right, so we're sort of rounding third here on the episode, as I say. So, Jared, any last little tidbits on that you want sort of people kind of treating themselves? Like, think of yourself like when you were back at Walsh
Yeah.
in college. Like, what were some of the stuff that you would want to hear?
So definitely, staying on top of the preventatives and warming up, by doing a dynamic warm up, your A skips, B skips before, especially before hard workouts. But I would even encourage before, just an everyday easy run, just to get that nervous system heightened up to the task that's demanded, and get those soft tissues pliable, and the nervous system primed, ready to go. And you said, with foam rolling before. I've actually tried that on myself, and my response is I didn't really like it, but I did find, what did work well for me, and doing a lot of like core activation,
Mhm.
and not just, your typical like sit-ups and planks and things like that, but like using a like a dead bug where you're, kind of moving in a like a contralateral pattern, like right
Yeah.
arm, left leg, as the running motion would be, like to mimic the running motion,
Yeah.
basically. So
Yeah.
that's, yeah.
No, I think the warm-up pattern is or warm-up exercise is really good. I know, I've talked a lot about how, like, on different shows about how if you watch, like, Kenyans and Ethiopians warm up, it almost looks like they're dancing,
Yeah.
it almost they're just going through these really unique movement patterns to just get the nervous system warmed up and ready to go, loosen up the fascia, teach you how to be tall, teach you how to fire all the right muscles, and all that sort of stuff. What would you say, Matt?
I would say, think of it as a graduation of processes. So if you're trying to do something athletic, start very minimal. So there was some research out. I think it was in 2019 when it came out that showed that like literally just walking briskly was as effective as doing like clamshells and monster walks and all
Yeah.
of that stuff. And essentially, they found that just doing weighted material, so like literally body weight squats was good, but literally just adding like I think it was like 25 pounds and just squatting beforehand literally gave you more activation of the glute muscles and hamstring. And I'm not saying that rehab exercises aren't, they're designed for specific purposes, but literally just going out and doing forms of what you're about to do. So
Yeah.
like walking briskly, walking is very similar to running. So if you walk briskly, almost like that awkward, like, do I run? Do I walk?
Yeah.
It gets blood flow. It gets the neurological system to adapt. It tells the muscle like to essentially like start to get involved. It's working the same patterns, just not at a fast rate.
Yeah.
And then once the tissue's warmed up a little bit, then start to get into like some of the other exercises that you've been prescribed or that your coach has told you to do. I do think that even though that's part of your warm up that you've been told, like if you need to actually get the muscles a little bit warmed up before you
Yeah.
even start to do that.
A lot of times I'll tell people to jump on trampolines.
Yeah. Well, and that's
Yeah.
great too
Yeah, I mean,
because you
like a
get
little mini trampoline, like just jump on it for a couple minutes, and that's a fantastic way to warm up. Especially if you're like waking up and running in the morning. Like wake up, do some breathing, jump on the trampoline, then do some activation drills. 10 minutes total, you're out the door. And that 10 minutes doing that, you'll make your run so much more effective. And it's worth running one less mile to do all of that and be more effective.
yeah, absolutely.
Man, it's fun.
Yeah, absolutely. All right. So thank you guys for joining us for another good show. We'll kind of touch on a lot of these topics throughout our different shows. Obviously, this is sort of our expertise, something we do literally, you know, 40, 50 hours a week,
Yeah.
just treating people and kind of getting everybody over injuries. And so this is a very near and dear subject to our hearts. If you have any questions or concerns or any follow ups on this, then feel free to reach out on our socials. And yeah, thanks again for joining us.
Yep, absolutely.